Okay. Thank you very much for coming today. Today we're going over a very exciting presentation. This is Chart Talk Documents, and this is one of the most versatile features of Chart Talk. So we're going to go in depth into how the Documents feature works and can make Chart Talk your entire electronic chart. I'd like to thank Kate Crisp for helping me out with this presentation today. All right, so the Chart Talk Documents makes Chart Talk very customizable for any of your clinics' practices. As we go through today, I'll show you how it works. Some of you may have used portions of the documents. I'm going to go through exactly what it can do, show you how to create custom forms, the difference between scanning documents in and attaching images, how to import information like lab works, CCR files, other things that help you demonstrate meaningful use, and some other features as well. So to start out with, Chart Talk Documents becomes your electronic chart. You can import any kind of images, any type of form, any document that's scanned by the patient. You can import into Chart Talk, throw away the paper copy, and actually turn it in so that you can back up all the forms, restore them, and then it makes it very easy to bring up and recall information as well as securely keep it on your database. So let's go through the first section, and we're just going to go through creating an electronic form. So I'll go through, and we'll work with Andrea Anderson right off the bat here. Select Anderson, Documents. So here's a list of all the documents. The last one was an initial consultation, but you see that there's x-rays, various functional assessment forms that can be associated with our new QUIC program, the Quality Initiative Kiosk. But let's do a new x-ray for this patient. So if you want to create a new document, just like in the rest of Chart Talk, you can either click or just say New. You'll see the screen turns light blue to show you that a new document is prepared. And let's use an existing form. So we can click on this Forms button and filter down, and let's just do a new x-ray template because that's one of the simplest. So this is all built into your Chart Talk right away, but you can edit it all you want. And in fact, these forms can be voice-enabled like the rest of Chart Talk. So if I want to go to the type of study field, all I have to do is say, type of study, lumbosacral study of the spine and pelvis, all caps that. Findings, scoliosis was noted at the cervical level, C4, C5, period. Spondylolisthesis was indicated and noted, period. Impressions, scoliosis. Next line, spondylolisthesis. Next line, advanced disc degeneration at the L4, L5 levels, period. Save. So I saved it, it turns white, and you can see here in our documents list that the date it was created, 3/29, an x-ray form was created. You can even attach a digital x-ray. So I'm just going to go through this real quick. I'm just going to attach and just point to a digital x-ray. So you can import these in through, if you get a CD, you can take a screenshot of it, scan it in, take a picture. A lot of doctors do it differently, how they're bringing in these digital x-rays. Click Open, and then it asks if you want to attach it to the current narrative or create a new form. And we want to attach it to the current narrative, so just click Yes. And you'll see it brings up, it has the x-ray attached, has the study indicated. You can even use the tools in Microsoft to add notes to the drawing itself. So if you just double click on the image, it brings it up in Paint, and let's say we just want to put an arrow in it. So we select arrow and say we want a yellow arrow just to point right here. Then click X. You can edit it all you want. Closing the file will save it. Then you'll see it's indicated on the screen, and it brings it up with your edits. One neat thing when you print this out, so if an image is associated with a document, it will automatically print it out along with your dictated form. You can either give the patient or have on record. It's just kind of a neat file to keep around. All right, so we will close that window. We'll close this. So that's an imaging file. So you can do that with MRIs, X-rays. Any image you associate with the file will be seen in this little window. All right, let's get back to the presentation here. So that's how we can use the Chart Talk documents to attach images, body diagram we'll go through later, MRIs. Now you see the form that I used. I'll show you how to create that here in 1 second. So any of those forms that you make, we come default with a lot of forms that doctors have suggested over the years, but you're able to create any clinic-specific form as well. So that's what I hit the form and drop down the menu to select the X-ray template. Now to create one of those forms, you go to the Tools menu, that's where a lot of the back-end tools for Chart Talk are available from. So you go to Tools and then the Documents Types tab, and then say or click New. Then you'll fill in the category by giving the document a name, and then create the form right there. You can even speech enable the form by adding the field names to the field form box at the bottom. And then when you're done, make sure to save. So let's go through exactly how to do this in Chart Talk. So when we'll go to the Tools section, Tools, then I'm already on the Document Types tab here. So you see I've got the X-ray form already brought up. So you see this is exactly what we saw before, type of study. And then when I said type of study, it jumped to this what's called a variable or a form field. Now if you want to voice enable it, you can also use a button on your power mic or use the Dragon Command Next field to jump between fields. But to voice enable the document, just take the name of this field, which is type of study, and add it in a comma-separated list to this form fields list at the bottom. That will make any variable that comes after any of these fields voice enabled. So if I say type of study, it'll highlight this study name. When I say findings, it'll highlight this area, impressions, this area. So this is a very simple form. Here's one that I've made for an initial patient consultation. So this one's got more fields involved. So you can see I can say social history, past medications. It'll jump to those fields when I fill out this form. So that is how to create a form. A couple other things that I'll show you. We've got some more tools. I'll click on this narrative form. As you see, I've got no information in the form area, so it's just a blank template. But I've clicked the Save Dictation. Any form that you create and you check the Save Dictation box, it will store your recorded voice in the database for playback later. So you can go back if you want to just do a long narrative report, not proofread. You can save your dictation, and someone can come back later, playing it back, and make corrections. And one other thing, you see these little areas that come up in blue? This is a new feature in Chart Talk 2012 with our Quality Initiative Kiosk template. So when you click on that, it gives you the question and then the responses to the question. Most importantly here, these will come in when you have quick. You can have a reminder frequency. So when a patient uses the kiosk, every 60 days they can check in and it will prompt them to fill out these functional assessment forms, which can then be imported into Chart Talk. We'll go over that at the end of the presentation here. So that's how to create a form from the Tools and Document Types tab. Now, scanning is a question I get a lot. How do I use that scan button? When do I scan? When do I attach? So we'll go over exactly the different tools you use and the different purposes that you want to scan documents in. So to scan documents into Chart Talk, if you want to scan one-sided images, so when you use the button in Chart Talk to scan, it will bring in a picture of whatever you scanned, just like we did with the X-ray with the click of a button. So this works for images, things that you want drawings of. If you want to create a document or if it's a multi-page, use the tool that came with your scanner. They all have different versatile tools, and then they can save those documents as a PDF, which can then be attached to the patient file. Let's take a look at exactly how this is done in ChartTalk. So we go back to the documents. So if we go into documents, let's say I've got this initial consultation. I filled this out before we did this presentation to save a little time. So I've created this initial consultation, and let's say I've got a pain diagram I had the patient fill out. So I'm putting that in my scanner right now. Right now I'm using a HP ScanJet 1000. There's many different types of scanners, but if you're going to use this scan button, it needs to be a scanner hooked up to the printer or to the computer you're using this on via USB port. So I'm going to click Scan, and right now it's pulling it through the scanner. My documents, I had a patient fill out a body diagram and circle and enumerate the areas where they fill out their pain scales. And then I want to attach the scanned document to the current narrative form. Yes. So here we go. I scanned it in. There's a little body diagram. When I would print this out, I can print. You see that the document's set up here. So you can set up any type of image to show up at different resolutions. This I have set up my computer, so I scan it in at 100 DPI, which saves on space when you scan your documents in, because the larger image you scan in, the more space it takes up in your database. One area to note is that if you are going to do scanning, make sure to set up your default settings so you're not scanning in super large images. Generally, this is overkill, and it fills up your database very fast. So if you want to just conserve space, set up the defaults of your scanner through your Windows tool. And to do that in Windows 7, you just click Start and Devices and Printers. You can go here and you see that here's my settings for my ScanJet, and I can configure the default properties right from there. We'll close out of this. So that's how to scan in an image. I'd like to also show you how to scan a document in. So here, since I'm in the, let me go into forms real quick. I'm going to create a new form called, hitting new on the functional assessment creates a new question. So I'll go to new, create a new form, signed HIPAA document. Scratch that. Sometimes typing's a little easier. HIPAA document, and I'm just going to keep this blank because these are going to be scanned images, nothing I dictate in on. So I've created this HIPAA document down here. Now I'm going to go to Documents and say I want to create a new HIPAA document for the patient. But this is going to be a PDF, so I don't want it to be an image. So I'm going to use the tool that came with my scanner to scan this document in and then attach it to the record. So you see here, I've got this HP scanner software. So this is what came with my scanner, and this is what you'd want to use if you want to do multiple pages or do a PDF document. Oh, now I've got to put the document into my scanner. So I'm scanning a signed HIPAA form in for the patient, which I'm going to import into ChartTalk so I can keep a record that the patient, I have a signed HIPAA document on file for the patient. And then here, do I want to scan another page? Nope, I'm done. Now I choose a place for it to save. I can save it in my documents. I'm going to go to the CT scans folder. and I'm just going to call it A. Anderson HIPAA. And then I save it. Now I go to Chart Talk, and I want to create a new HIPAA form, and I want to attach. Let me just go to Documents here. So here's my A. Anderson. And yes, I want to attach it to the current narrative or form. And you see here there's a little icon that says there's a PDF associated with this file. So if I were to double-click this PDF, opens it up, and I've got it set up so it comes in black and white at a low resolution so it doesn't take up all the space in my database. Now you can see if you ever want to go in and say, okay, do I have a signed HIPAA form on file for this patient? You can use the filter box to filter that list to see just a certain document type. So I've got one HIPAA signed document created on file at 3/29/2012. That works if you want to see all the x-rays you did on a patient. Filter, click x-rays, and you'll get a progression of all the x-rays that you have for the patient right there. Back to the presentation. So that's scanning. So there's two different types of scanning. Scanning an image in using the scan button in Chart Talk, or use the default program for the scanner you have to create a document and then attach it to the patient's file. Okay, so attaching images as well. So that's what we did in the beginning, where we attached the x-ray to that initial document. So this is how you'll work. So attaching any type of image will show up in this little image display area. Attaching any type of document will attach it to the patient's record, and when you double-click on that record, it will open up in the file's native program. So with, say, PDF, it opened up in Adobe Reader. If I were to attach a spreadsheet, it would open up in Microsoft Excel, Word documents, Microsoft Word. You can even attach audio files, movies. Any type of electronic document can be attached and stored within Chart Talk to be opened up in its native program at a later time. And that's just using this little attach paperclip icon. So again, to go over how to attach an image, you go to Documents, create a new document, select your form, click Attach, navigate to the desired image, and click Open. And once you're done, just click Save. Afterwards, you've got the ability to open an image and edit it. We just use Microsoft Paint, but if you've got a more advanced program, you can use that. To set that up, because when we scan in or attach, we've set up so it comes in as what's called a JPEG, and that's just a digital image file. If you want to set Microsoft Paint up as the program that will automatically open that, you can just go into your settings, default programs, and you can set up the default program for any certain file type. So I've set up my default program. I want to use Paint, and then I choose the defaults for this program. And you'll see here I've checked all the boxes for all the JPEGs. So I just wanted those images to be edited in Paint, all the others to choose whichever program their default association is with. All right, now labs. This is probably this is a requirement for a fully certified meaningful use program. A lot of you aren't using this, but I'd just like to show you how it works because it's very interesting, and this is kind of the future of where EHR is going. And this is why you have Chart Talk, is because it can do things like this. You see, don't let a dog mess around at the lab because they don't have any idea of what they're doing. Let's go into Chart Talk. So say this patient, Andrea Anderson, if I were to receive what's called an HL7 file containing her lab results, I can go in here and just click lab results, and it points me to where I want to import from. So I've got that under my demo file. So here's Andrea Anderson lab results from Mighty Oak Labs. So this is an HL7 file. So ChartTalk knows intelligently if it's properly formatted to be a lab, a file from a lab. If you click open, do you want to attach it to the current narrative form, or do you want to create a new narrative? So I'm going to click no because I want to create a new narrative report. So you see here it instantly brings it in. It has the patient's name, patient ID, the laboratory it came from, and then all of the patient's laboratory results. And if they're in normal range or not. If you import like this, you can use the ChartTalk alerts to bring up alerts and patient education on different levels if their triglycerides are high, or so you can further identify and do more stuff, more requirements of meaningful use, such as clinical decision support and patient education. Brings it in. I'll just show you something real quick. So if we double click, this has a file associated with it, just like that X-ray. If I were to double click it, this is what the file looks like. So you can't really read that too easily, but ChartTalk is able to take this information and convert it to this area where you can actually make decisions based on this. So that's the lab results. That's an HL7 message. If you work with a lab and you're interested in using this feature, contact them and ask them if you can get your patient's information in an HL7 format. Okay, and then another requirement of meaningful use is the continuity of care record. So this is another highly structured coded file, but this is the information that you move between systems. When you're required to share information or transfer of care, it is a CCR file that meaningful use prefers that you use. If you have a fully certified system, they're able to export a CCR file to you that you can import, or vice versa. You can export a CCR for a patient and then send it on. What a continuity of care record contains is the patient's name, their active medications, allergies, problem list, and lab results. Does that sound familiar? This is all the stuff on the front screen of ChartTalk that we have in initially phase 1 of your meaningful use, because this is what they define as the important information for all providers of care to get a snapshot of kind of where the patient is, allowing other doctors to perform medication reconciliation, more requirements of meaningful use. So let's go through. I'll show you how we import a continuity of care record. So just like we did with the lab results, we're going to create we're just going to attach a new file. So we're going to create a new, and then we attach. And here I've got an Andrea Anderson CCR sample. So when I click open, and it asks you, do you want to process it as a CCR, CCD? You click yes, and then I want to attach it to the current narrative. Yes. So you see here, I've got the wrong name of the person in there, but just a good example. So here's our example. Here's our problem list, allergies, medications, immunizations, and lab results. So you can bring this up and you actually use this to perform medication reconciliation, add problem lists. So if you want to, you can see that they have an active diagnosis of hypertension, which will lead you into other requirements of meaningful use. So that's just attach. If it sees that it's a CCR file, ChartTalk will automatically process it as such. Okay, and then the last is we're going to go over our functional assessments. So we have introduced the Quality Initiative Kiosk. We've got the logo now, so we're actually building the installer, going through in the last testing area, but we should have the Quality Initiative Kiosk available for use in the next month or so. So what we have there, let's just go, I'm going to give you an example. Select Aronson. This patient, you'll see here is a bunch of various outcome assessment forms. You'll see that here's a hard copy. This is all generated from their patient, from the Quick program. Prompts them for the question, brings the answers to their questions in here, and then scores their test. You can come in here and kind of look at the graph of how the patient is progressing over time and what score they have to base your medical diagnosis and treatment on, as well as participate in some other different quality initiative programs beyond meaningful use, such as PQRS and the NCQA low back pain program. So we're trying to move forward. I know meaningful use isn't the be-all, end-all. It's just the hot topic of today. But we're making sure that Chart Talk will be ready for you 4 years from now when there's more new requirements for you to be demonstrating. So that's the Quality Initiative Kiosk. Thank you very much for attending. I know this was a lot of information in the process. The recording of this demonstration should be available in about an hour after we finish up here. Next week, on April 5th at noon, we're going to be taking an in-depth look at using Dr. First, both the e-prescription and how to use it for drug interaction checks, drug allergy checks, drug problem checks, and how your system is doing drug formulary checks even though you're not prescribing or if you aren't prescribing. That's it for today. Thank you very much for attending. Look forward to working with you next week.